Measures taken to protect the country's drug supply are garnering criticism, with City News receiving multiple messages from Canadians who say these new rules are costing them more money and putting them at risk. The new policy sees pharmacies filling prescriptions 1 month at a time instead of 3. The changes were introduced to protect medical supplies during COVID-19, putting less pressure on pharmacists and the supply chain after the issue was flagged by these frontline workers. A senior couple living in rural Ontario say that's made life difficult for people like them.
I don't understand it. I'm putting myself at risk. I'm putting my wife at risk once a month now on a continuing basis.
Ed and his wife, who just recently had a surgery, are in their mid-60s, which means they're both vulnerable to the virus. But this change means Ed is making more trips outside to his pharmacist.
I'm ending up going there probably 2 times a month, every month now.
They both require over 5 prescriptions each, including insulin. But with this new policy, they are also paying more to get them dispensed.
It's costing me 3 times the dispensing fees and 3 times the gas that I used to spend for these things.
The couple pays a little over $4 in dispensary fees per prescription. But in Ontario, this fee can be as high as $13, depending on location and an individual's financial circumstances. Pharmacists are seeing more patients now more than ever. Back in March, when the outbreak was declared in Canada, these frontline workers rang the alarm after seeing a surge in demand for prescription medications, saying wholesalers were also experiencing shortages and back orders for meds like inhalers and insulin, requiring quick action, which led to the change. Ed is calling on officials to waive the 1-month rule for seniors, especially those living in rural areas.
I wouldn't want a senior exposing themselves.
The NDP is also calling on the province to cover the drug co-payments for seniors in Ontario. City News reached out to the province today. A spokesperson referred us to a statement made on March 23rd, where the Ministry of Health and Long-Term Care said, quote, dispensers may use professional judgment to provide a longer day supply in exceptional cases with appropriate documentation. The supply should not exceed the usual supply for the patient. Meanwhile, here in Toronto, one pharmacist tells me that he and his colleagues have been waiving this 1-month rule for exceptional circumstances. Also adding that pharmacies across Ontario have also been offering either free delivery, curbside pickup, and other alternatives. So you are encouraged to have these conversations with your pharmacies. In Toronto, I'm Faiza Amin for City News.